That means you're extra. You know.
Greetings, it's Deidre. Willfully, you can all hear me okay. So as you come into the chat, just let me know if you can hear me. I know I'm a little bright today, so I picked like a really sunny spot in the park because I just thought it was a nice spot to pick while we talk about updates with vaccine. Greetings, Shifuya. Thank you for joining us. So we're gonna have like a quick chat, a quick update on what's up with the COVID vaccines. If you've been following along, there's been a lot going on, especially when it comes to variants, which is different from mutations, and the infectiousness, infection rate, and the contagiousness of the new variant, and all of the different ads and things that we've been seeing. Oh, great. You can hear me. Good, 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 good. So, shalom, everyone. So, let's get started, right? So, what's happening now with the vaccine? So, we know that we're, at least in the US, we still have three different versions. So, that's the Pfizer, the Moderna, and the Janssen, which is also Johnson and Johnson. Janssen is the name of their pharmaceutical area of their business. Shalom, Akuya, Bisa, thank you for joining us. So, as we talk about COVID, like some of the things that we want to know about this vaccine is like, well, what's happening? Why are we continuously inundated with ads, you know, suggesting that people get vaccinated? And again, so as I always do videos or podcasts, this is in no way for or against vaccination. It is a personal choice. So as you learn more willfully from this podcast, wow, as you learn more about vaccines or vaccination, you can make an informed decision, an informed choice on what you decide to do. Because it's, after all, everything is about your health, and any information that comes from this channel or True Health Live is about providing information so that you can make informed decisions about your health and healthcare. So back to what we're saying. So we've been inundated with all these ads and all this information, day in and day out, not just on the news, but like if you stream television, if you're on Hulu, Netflix, like, every other commercial, but aside from shopping, is about, being vaccinated. And even the shopping commercials are about being vaccinated, because the whole point is the powers that be, so the CDC, the World Health Organization, they're really pushing for vaccination because they're saying that if we don't, we won't reach herd immunity. So there's a real push to reach herd immunity for a few different reasons. So let's back up and say like where we are now. So currently, globally, only 20% of the globe's population, and the globe's population is about 7.8 billion people. So only 20% have been vaccinated completely, like both doses. And in the US, about 42% have been vaccinated, both doses. It's over 50% that have been where there's a combination of both doses plus at least that first dose if they're getting the double dose version of the vaccine. But overall, completely vaccinated, there are 42% of the entire U.S. population. The U.S. population is about a little over 300 million people that are in the U.S. So what does that mean? So experts are saying that in order to reach herd immunity, and what herd immunity is that there's a percentage of the entire population that if they're vaccinated, then that means that those people who have not been vaccinated for whatever reason or another, whether it's because they had underlying conditions where they were not able to receive the vaccine, or maybe they are people who are being called no vaxxers, whatever, they just don't have it. Those people who are vaccinated, there will be enough of the population that will reduce the rate of infection and the chances of getting the disease so that those that aren't are protected. So it's kind of like those that are vaccinated will be like an umbrella of sorts, if you want to visualize it that way, for those who are not. And in order to achieve herd immunity, currently those numbers are anywhere between 70 to 90% of the US population. So we're on US now, we're not talking global. 70 to 90% have to be vaccinated fully in order to achieve herd immunity. So that is a little bit of what's behind like all of these ads and all these pushes to be vaccinated. You might be asking like, why does it matter so much? Why am I being inundated? And that's the reason why. And so some of the tactics that have been used, which is really interesting, is like, you can go to theme parks again, and a lot of places are, opening up to vaccinated individuals. It doesn't mean that people who are not vaccinated are stuck in a certain place. Like, you can definitely still move around, but there's incentives to be vaccinated that different businesses are offering if you get vaccinated. So like, and so a lot of the commercials are, you can shop again, you can go to theme parks, you can go to concerts and sporting events. So that's all the different kind of carrots that they're using in order to entice people to go get vaccinated. Because at some point, like, I think there's like a little bit of leveling off. So they want to, really push out the ads and getting people to kind of get to that space. So then you might ask, well, then why are some people not wanting to get vaccinated? So another thing that we've also seen are the different side effects from the various versions of the vaccine. So, some people after the first dose, they experience chills, fever, body aches, things that are, really reminiscent of flu symptoms or mild, I guess, COVID symptoms. I don't know because I haven't had it. This is just what people are reporting. Knock on wood. Um, and a lot of it is like common. So what the CDC has listed as like common symptoms that people are experiencing are really similar to what people experience when they have like the flu. So the common symptoms are pain, and this is on the site. So it is a jab in the arm. So site symptoms are like pain, redness, swelling in the area where you got the shot. Other body symptoms are, fatigue, um, fever, nausea, chills, headache, muscle pain. So those are those. Some of the more, and specifically one that I wanted to point out, one of the more severe side effects has been issues with inflammation of the heart muscle and or surrounding tissue. So it's myocarditis or pericarditis. So anytime you hear the suffix itis, it is an indication of inflammation. So myo is the heart muscle itself, and the peri means like the lining of muscle tissue around the heart. So those are some of the more severe symptoms that people have been experiencing. And recently, we know that the vaccine has been opened up to individuals as young as 12. So like 12 and up, people are able to get vaccinated. And so this has been like a point of concern, especially for parents, when we're seeing that a lot of people who are experiencing this particular severe adverse event, and that's what they call it in research, or what they'll say is like it's a severe allergic reaction to the vaccine, but it's also a severe adverse event when we are discussing research. Um, so this particular severe adverse event where it is affecting the heart tissue, they're seeing it in individuals who are younger than 30, and specifically a lot of like teens and 20-year-olds. So we're thinking about the vaccine being opened up to younger individuals, it has been a point of concern. So, a lot of these things go into, if you're asking yourself like, well, what would make a person like not want to get it? So these are the things, for some people, incentives to theme parks and sporting events and things like that, it's just not enough for them. They need a little bit more assurance. And for someone who comes from research, I could understand that, like needing those assurances. Like when we do clinical trials, like even like the human part is like the last phase of it. And so for some people, if they're, they may be thinking, and a lot of the times you can get more information if you go to the World Health Organization website or the CDC website, which will explain like the effectiveness of the vaccine and how it works, how it moves within RNA and not necessarily changing DNA and things like that. But again, it is a personal decision to get vaccinated. There are many different reasons why people are not. And, it's not like people who are not getting vaccinated, they're not a monolith. So I think that there does need to be some understanding as to why they're not. And emotionally mature and adult conversations if you ever meet someone who is deciding to not be vaccinated. And what we'll learn is that a lot of times, like people, not everybody who's deciding to not get vaccinated is out there like, with their picket signs, I'm not doing it. Some of them are just staying quiet. So these are some things that we have to, just be cognizant about. So I'm just gonna go to the chat really quick. Shalom, everyone. Peace, Sister Kashia. The vaccine is almost like freedom papers these days. Yes, we'll get into that because I think there are like some misconceptions as to how those freedom papers work. She also says, though I'm not interested at all in the shot, it's a definite no because I do not have youth yet. I do not want anything affecting the process or the seed being affected by all that. And I'm so glad you said that because these are some of the reasons. So it's not as simple as like, well, we don't know what's happening and it was made too fast. There are a lot of people who don't want to take it because the array of people that where the studies were done, it just wasn't enough. They only started um, clinical trials on pregnant women um, probably around late February, early March. We check out True Health Live podcast where we talk about vaccines. It's episodes 2 and 3, and you'll have more information on that. But the information regarding vaccines is changing every day. However, when we're talking about when they started doing the trials, that information is there. So you can go to DeidreSully.com and go to the podcast page and check out episodes 2 and 3 where we talk about the vaccine, and gives you all like the beginning information regarding like even the breakdown of what types of vaccine it is. Our doctor Alia Komsani goes into like um, the medics, clinics of it all. I'm not a clinician, so like she gives us that piece. But anyways, yeah, there are a lot of people who are like, I haven't done certain things in life, right? So I don't know how that's going to affect me. So just like Kashia said, I had a guest. If for those of you who watch faithfully, thank you. One of my guests on our public health career spotlight, she shared about her having fibroids and she not wanting to necessarily take the vaccine because there wasn't necessarily information on how they did the study when they did the trials with women with fibroids and how that might affect them, and especially a woman who also has not born children yet. So these are some of the things that people are concerned about. It's not as simple as well, we don't know what's in it, and we don't, and it took them too fast. It took them too quickly to make it. Those are valid concerns, but if you dig a little deeper, you'll see that there are other concerns too. And then again, not to mention, as we are getting more information, even though while we're still getting like all these ads, like you can be vaccinated. Let's get back to normal. There's that like wanting to get back to normal, which a lot of people want to get there, and just kind of feel some sense of like. Being regular again. It seems that a lot of people don't want the new normal, but the reality is we're going to have to get used to that. But they want to at least try to salvage some sense of what was before pre-COVID. So yeah, you do have a lot of people who just are just thinking differently and moving differently with regards to the vaccine and like it being something that they don't want to do. And as far as it being freedom papers, because I do want to get to that. So there are there. So this is the interesting thing about the freedom papers. So there are what we call it's a vaccination card. And the interesting thing about the vaccination cards, they're actually like 200 years old. They're not new. They're not new. Um, they were. I don't remember what in my research where they were first created, but I'm gonna take us at least back 100 years. So this was something that was being utilized when we had the outbreak of the Spanish flu, and that was the last pandemic that we had. And this is another reason why everything's a little bit, everybody's nutty because the last time we had to deal with this, number one, we didn't have smartphones, we didn't have technology the way that we do now. Um, and there weren't as many people on the planet. So there are a lot of things that we didn't have then that we have now that make things a little bit worse. But the last time we had to deal with this was 100 years ago, a little bit over 100 years ago. It was 1918. So vaccine cards or passports, as we're calling them now, were not anything. They're not anything new. They've been around for quite some time. They're just being revived. I guess we could say they're being revived, and so a lot of places they are. I don't want to say requiring because again, people it is not required or mandatory for people to be vaccinated, and that's what has to be very clear. Yes, the CDC is recommending and encouraging and highly strongly suggesting for people and individuals to be vaccinated, but it is not a mandate yet, nor is it a requirement. So while they are using vaccination as an incentive, it doesn't mean that if you're not vaccinated that you can't. So this is why a lot of places are still maintaining the universal precautions. So the social distancing, keeping 6 feet apart, washing your hands. That should just be a universal precaution like for life. We shouldn't even have to wait for a pandemic for that. But wearing the mask. So the ones that are very specific to COVID, wearing your mask and making sure that you're maintaining social distancing. So yeah, I just wanted to put that out there that the passports are actually not new. They're just being revived. Just gonna go back to the chat. This moves so quickly. Um, because she says, I've seen some instance of supposed miscarriages as well. I haven't seen that information just yet, but I will say, for information, and I'll definitely make sure to put this in the description. Um, there is a place. So remember, I was talking about the one of the specific allergic reactions or serious adverse events that people have been experiencing, which is the inflammation of the heart and heart tissue. So that's SAE, serious adverse event. There is a database called the Vaccine Adverse Events. I forgot what the R stands for, but it is a database that collects all the information on adverse events relating to vaccines, period, not just COVID, but all vaccines. It is very extensive and it's been around for a while. The only thing with that, they're not, these are unverified because anybody, so a health provider, a pharmacy, and a regular Jane or John Q can actually log in to report a vaccine related adverse event, but they're unverified. However, I'm sure that when we get information from the CDC and that VAERS, which is the acronym VAERS, it goes to the CDC and they really use that to help give information. But of course, moving with substantiated information because we can't necessarily, if anybody can just go into the database and say, oh, well, this is happening, then we have to be like, okay, well, where is this coming from? Especially if you do have people who are against vaccination, like this is where information and knowing how things are gathered, knowing how research works, this is why it's very important because if we have these places where we can get this information and database, yet anybody and their mother can put information in, then how do we know that it is accurate? So that's why we have to kind of use discernment and discretion. So yes, while this is can be a good indicator, you can go to this website to get information on who's experiencing what with what vaccine and when and death dates. Like it's very extensive. You have to be able to, if you're not a researcher, it may be a little bit difficult. So like going to the CDC's website, the World Health Organization, where they have, trained researchers who are, putting this information together is helpful. Again, even with that, it's always good to use your discernment. The geese are back. It's always good to use your discernment when you are, reading statistics and data. Um, Aquia says, I wonder how they are measuring the stats or for effectiveness of the vaccine. Um, oh my goodness, I totally like wrote that down. So a lot of the effectiveness is measured based on it's so with anything when you have a study or if you have any drug that's coming out, like the effectiveness, like is measured based on like how much serious adverse events are have been reported or experienced by if it's a trial by the trial attendees or by the people who are actually receiving like the vaccine, whether it's like a vaccine, like the actual drug versus placebo, like they test based on like um, um, immunity. So, for example, with the vaccines, and I can't tell you like exactly which one, but there has been a level of like decreased effectiveness. And I'll say this because there, as we know, there are variants, right, to the COVID um, disease infection. There are variants, so it's been changing. So when people are getting vaccines, this is the other reason for the push for people to get vaccinated, because the logic is if we can get people vaccinated quickly, because the newer variant is more contagious and it transmits very fast. As we've seen, it's been sweeping across the UK. So and they're calling it the Delta variant. So that variant is moving very quickly. So the logic is if we can get people vaccinated quick enough, then maybe it will protect them from, the variant, because it'll be moving through their system, et cetera, et cetera. However, they have noticed that there has been a decrease in like effectiveness since the original or the first doses have been given out. So, for example, I think in the UK, like effectiveness has decreased about to like 70%. And some places it's decreased from like 70 to like 60% when they're measuring against the new variant. So there, this is why I think it's a personal choice and a personal decision. And like having the information about how all this is happening is key. So I'll make sure to put all the links, the necessary links in the bottom so you can find this information and articles. But knowing all of this is the reason why collect it, have that knowledge, so you can be wise about the decision that you make with regards to your choice to be vaccinated or not. I hope that was helpful. But yeah, they measure it based on like how people are continuing to contract the disease, how they're seeing rates of contraction fall or rise or not. She says also, with the exception of required shots for overseas in the military, my entire life has been without vaccine. This shot could shock my body. I feel safer without it. Yeah, there are different reasons. There's other reasons. If you're not a person who's, if you're more holistic in your eating and how you know, address illnesses in your body, taking drugs is not going to be good, period. Like, regardless if it's a vaccine or it's like aspirin. If you're not used to that, yes, you will shock the body. It's not good for you. Even if you've gone through like a transition and you haven't eaten in a way for a while, right? So, for example, I and this is my own personal thing. Like, I've been plant based for about 3 years now. What keeps me, even though like I probably still have like I not even probably, I still have these urges like all the time. But one of the things that definitely keeps me, aside from like, not putting on extra pounds, but one thing that keeps me from going back to like, and also, having to deal with like curses, because we're not supposed to be eating chicken. But like one thing that keeps me from eating the meat and the chicken and things like that is because my body has not had it in a while. While it's possible that it could recognize it, for however many years of, eating that and ingesting that type of food, my stomach has not had to digest that in a very long time. So what keeps me from eating is like not wanting to have to deal with the aftermath and the shock of my body saying like, what is this? We don't do this anymore. So like, I use that same logic when it comes to drugs. If I am not, if I don't take any kinds of drugs, hard, over the counter, whether illegal, illicit substances, any kind of use, you damage yourself. We already know drugs damage, whether they're legal or not. It's damaging. Um, yes, thank you. Hit the like button. Sovereignty says, were the passports mandatory when they were initially introduced? I don't have that information right now, but I can put that in the chat for you and get that information for you today. Um, but I don't want to assume, but something tells me not, because if they were mandatory when they were introduced, then it's possible that they could have been mandatory now. So notice that things are mandatory when you want to use public and government services. So if you want to send your children to public schools, vaccinations are mandatory. But vaccinations in and of themselves are not mandatory. You can go your whole life without being inoculated by anything because it is not required for you to do so. But if you want to move in certain places, they do, and the powers that be can be they, whether it be a private business owner or whatever. If they want you to like have certain things before entering into their premises, then that's what it is. So then that's where you have to make the decision of something is what you really need or is it what you want. But I will get that information on whether it was mandated back then. Because when we mandate things, like when things are mandated or if they're put into legislation, that means the law has to be written. And if the law is written, that means it's there until there's a law that either nullifies it or strikes it from the books. So everything is done through legislation. Sovereignties, did you share the demographics? I know historically people of color are underrepresented in clinical trials. I wonder if there are variations of effectiveness and effects based on ethnicity. You know what? When I was looking, because there's this weird looking bug. Me and bugs don't get along like that, so he had to go. Um, when I was looking up the information in the VAERS, like which took forever and it never even came through because it was so much data. The only demographics that I could search by, which was really interesting because they always give information by sex, gender, race, but race was not on there. So I'll have to go back and do a little bit more digging with the data that has already with the verified data that is used by the health organizations to see about the clinical trials. But you are right, we are a lot of the times underrepresented. But there's also a reason for that. A lot of the times we don't go because there's a historic mistrust of healthcare systems. Rightfully so. Um, Rightfully so, yet we have to grow, right? So if we are going to have spaces where we want to acknowledge and point out that people of color, Black people specifically, are underrepresented in places, then if that's where you want to, put your energy, then you have to be in those spaces. And the only way to be in those spaces is that if people know about these things. So yes, there were people of color and Black people who were included in the trials, but you're right. Like generally, we're underrepresented, and like if we're never going to be equal amount to those individuals who are non-melanated and or non-people of color, white people, because they outnumber in this country. So statistically, if you're going to have a clinical trial, that is reflective of the population. If African Americans are 13%, Latinos are 14%, I'm just random numbers. White people, I think, are like 70%. Then if you're doing a clinical trial based on especially something like COVID that's affecting the entire population, then the clinical trial should reflect the population. It's not going to be like, oh, okay, well, we have 50% white people, 50% Black people. It's not going to be like that. The population will reflect the population of the trial, the sample size should reflect the larger population. So if we have a clinical trial and 70% of them are white, 13% are Black, and 14% are Latino, and this percentage is everything else, then that is a little bit more accurate. It's never going to be 30-30-30 or 50-50. It's not going to be like that. The sample has to be reflective of the reality of what we have. What did you say? I wonder if there are variations of effectiveness. Yeah, so those are things that we have to look out. I don't know that they are giving variations of effectiveness based on race. What I have seen are just general It's general information on effectiveness, not necessarily broken down by race. But what is being highlighted is that, of course, underserved neighborhoods, vulnerable populations, need to be educated and we need to make sure that they have access to the vaccine and things like that, which actually brings me to, I'll jump back into the chat, but I want to just make this quick um, notice that it actually brings me to what they're calling G7, the group of seven. And these are like 7 nations that are pulled from the G20 summit, I believe. And they have pledged basically to donate 870 million. I'll put in the chat if I'm saying million and it's supposed to be billion, but 870 million doses of the vaccine. And this is because, we know that poverty is an issue, and there are a lot of countries who may not necessarily be able to afford that mass distribution or even purchasing it from the pharmaceutical companies. Because let's be real, they don't do nothing for free. They just carved this whole globe up like, a piece of blue cake. And it's like, AstraZeneca took this one and Pfizer took this country and this person took that country. So I'm going to be, we're going to be very real about what that was. But not everybody has the funds to, make sure that that rolls out, whether it's the vaccine or not. Not everybody has that. So countries that are more, I guess, more first world countries or developed nations, developed nations. These 7 have pledged to donate 870 million doses to places that don't necessarily have the resources to get that. So that's what we, start talking about, those who are underserved, not necessarily in the United States, but globally. Segmented. Yes, Taiwanese knows I can't deal with segmented body. I'm a little bit better where I don't hop up and down and scream. Oh my gosh. I did something so bad. There's a segment here. I think when I plucked them in half. I'm so sorry. May the nature gods forgive me. Oops. But yeah, segmented bodies. Aquila says it may be that not many went for the trial, which is good. Maybe. I don't know that told off for that break. I didn't know that. I don't know what you're talking about, but I think I'm gonna go back in my head and maybe I'll remember what I was talking about at that moment. Thank you for that explanation, Deidre. You're welcome, and I will definitely make sure to put things. After this live, if there was a question that you had that I didn't, respond to, or something that was burning, just put it in the comments, and I will answer in the comments, or look at the questions, and I'll put the places where you can find that information that I found in the description box. But even though, for example, I was talking about the VAERS, where people can report the adverse events, even though it's unverified, I do suggest that people go take a look at it, because when you are not versed in research, this could be a really good, fun and interesting way to use these free databases, especially this is relevant, right? It's happening right now. Use these databases to find out information so you can actually learn how to pull information for yourself. So going to the site and kind of playing around with the drop down boxes to see what you want to know, and anything that is an acronym, because in healthcare and public health we use acronyms all the time up to wazoo. So you can definitely Google any acronym and Google some of the names or words that you don't know, because it can be really mind boggling. But I would definitely say, even though it's unverified, I'll repeat myself, even though it's unverified information, it is still useful, because getting used to pulling information, global, whether it be global information, getting used to pulling statistics is a good skill to have, even if it's for yourself. I'm so sorry. I will do something to make amends. I didn't know. I thought he had wings. I thought the bug had wings. It's not public health for humans only. I was just trying to move him off myself because he was crawling in the bag, and I didn't want any surprises later. I didn't know. I'm so sorry. I'll say a few words for it before I leave the space. I'm so sorry, Bug. Poor Bug. Yes, poor Bug. Poor Bug. Okay, well, I think that's a sign that it is almost time to go. That's called statistics. Yes, it is called statistics. Talk about racial. It is called statistics. Queer. Yes, yes, poor Bug. Okay, we get it. I'm sorry about the Bug. I'm so sorry. I'm gonna move from this space because might have had children. So let me move from this space. But I just wanted to go over that because, of, again, a lot has been happening with the COVID vaccine. So I thought it was important to, like, do a check in because the first time we did it was like earlier this year and things have shifted a lot. Before I go, I wanted to explain, like, give a little bit more information on holding the stand because the wind is just like, you're done here. I wanted to give a little bit further explanation about the variants, right? So the current, there's been four so far. So right now, the variant that is getting a lot of attention, and it's because it's proving to be highly transmissible. It is sweeping across Europe like crazy. It was first noticed in India this year, and we saw like what was happening early a few weeks, I want to say maybe a month back with India. Like it just kind of is devastating the population. And again, sweeping through Europe, it is here. The Delta variant is here, and so that's another reason for like the push in public health campaigns because technically it is part of that preventing disease and promoting health, which is what public health is about. So the variant is here, and that's a big reason for the push in getting vaccinated from the powers that be. But the thing about that variant, I wanted to explain, like when you hear these names, so specifically the names, so there are different scientific bodies, and they have their scientific names that none of us are probably going to understand unless we were like, research scientists with white coats in labs. They have like letters and dots and periods. But the World Health Organization actually has like an easier way of identifying these variants. So right now, this is the Delta variant. So they are actually using the Greek alphabet to identify all the variants that we've had so far. So Delta is actually the fourth letter in the Greek alphabet. So the first variant was Alpha, and that was the one that we were seeing in the United Kingdom earlier this year. The first instance of it was actually 2020, but they started talking about it earlier this year. And so that was in I think December 2020. And a little around the same time, there was the Beta variant, which was also called the South African variant, because that's where the first case was reported in South Africa. And that was the Beta variant, also around like December 2020. Then the Gamma variant was, oh my goodness, where was the Gamma variant? Gamma. School days. Brazil. So in Brazil, there was the Gamma variant, and now we have the Delta variant, which is the fourth. And each one has been, different from the other. And so just to explain a little, we say variant and not mutation because a variant can actually have several mutations in it. I do know a little bit of the clinical stuff. But the mutation actually happens like in the RNA, and then how the disease presents itself is what we call the variant. So the variant can have many different forms of the mutation, and the mutation happens when the disease is when the virus copies itself and it doesn't copy exactly. So that's a mutation, and then how it presents itself in the body is the variant. So that's the difference. That's why we call it there. So right now, what we're dealing with is the Delta variant. And so that's the thing to be on the lookout for because it is spreading fast. So this is where I'm going to say, like, I'll go back to the original point. Getting vaccinated is a personal choice. However, we do have to be very mindful of how we move around in spaces, how we share space and communicate, making sure that, what we're impregnating one another with. So maintain those universal precautions. 6 feet. Give me 6 feet, 6 feet, 6 feet, 6 feet, and wear your mask. So with that, let's take one last question. Does the vaccine prevent contracting the new variant, or is it just minimize the intensity if contracted? So that's kind of similar to the question that was asked before, like with regards to effectiveness. It may not necessarily prevent from contracting the new variant, just like it may not necessarily prevent you from contracting COVID, but it lessens the chances more than if you didn't. So they say. So, so I hope that answers your question. But it looks like I'll be putting like a whole lot of links for people to get information. So I'm gonna review. I'll review some of these questions and make sure that I put the links down below so you can like follow up. And like I said, take a look at the VAERS and kind of play around with it. Sometimes those things can be fun, and you can get a lot of information and learn how to pull information for yourself rather than waiting for it to be delivered to you. Some things we do have to wait because we're not researchers. So we do have to wait for the professionals to give it to us. But by you doing it on your own, it helps you, suppose it, yes. So it helps you kind of learn how to read statistics because it's not as easy as one would think. Reading statistics, there is some skill building and some learning how to interpret them, I should say. So like start looking at that because I think it is a helpful and useful tool. So with that, we'll close out. Thank you so much for joining me again. As always, make sure you like, follow, share, and subscribe. Also, go visit the True Health Live channel on YouTube. Like, follow, share, and subscribe. You can visit deidresully.com and get all the different information from my blog posts and the podcast. We recently released episode 12 and it's talking about menthol. We had a guest host join us who's a lawyer from the Public Health Law Center. She'll also be joining us later this month for our career spotlight. So make sure you head on over to deidresully.com to get more of that information. Make sure you check out some of the other information with Deidre's as I like to make sure that I give as much information as I can because as always, the more information we have, the more we can make informed decisions about our health. So thank you again. Thank you all of you for joining me and I will see you in the forward. Peace.